I'm Dr. Lynn Silver. I'm a pediatrician and researcher at the Public Health Institute in Oakland, California, and lead author on this new study that's coming out on the Berkeley soda tax. So Berkeley, California was the first jurisdiction in the United States to pass a significant soda tax. The tax was a 1 cent per ounce tax on sugary drinks like sodas, energy drinks, sports drinks, sweetened iced teas. It's a tax on the distributors, not on the consumers, but on organizations like bottlers that distribute these products to local businesses. The study had 3 parts. We looked at 26 stores of different types in the city. We looked at 15.5 million consumer checkouts from large grocery stores in Berkeley and in surrounding cities for comparison. And then we also did a telephone survey of just under 1,000 Berkeley residents before and after the tax. The exciting news is that the tax appears to be working. People in Berkeley purchased about 10% less of the unhealthy sugary drinks like soda and energy drinks, and they purchased more of the healthier drinks, including 15% more water, which was great. Their grocery bills did not increase, nor did the revenue of the local store study decrease. And it raised $1.5 million in this relatively small town that's going to nutrition and health programs. So overall, it appears to be a home run on a public policy. The tax was primarily passed through exactly to the tax unhealthy products like sugary drinks. In the large supermarkets, their prices went up by about 2/3 the amount of the tax. And for soda, for example, it was fully passed through to the price of the soda. In contrast, healthier untaxed drinks did not see a larger price increase in Berkeley. So we had a couple of surprising and very positive findings. The first was that sales of water went up by almost 16%, which was great. A second finding was that in the first year of the tax, the decline in sugary drinks in Berkeley, which is a prosperous city, was even greater than in Mexico in the first year after their tax. Purchases of sugary drinks in Berkeley fell, even though Berkeley residents were consuming very little compared to the national average. In other cities and states where people consume at higher and more typical levels, the tax will have a larger impact. Before the tax in Berkeley, evidence and common sense suggested that a soda tax would help people in the United States make healthier choices about their beverages. But now we have the data to show for it. So cities and states that choose this policy option can move forward with more confidence.